'Tis the season to experience chills, fever, headaches, diarrhea, nausea, vomiting, joint and muscle ache, all of which are symptoms of influenza, or better known as the flu. According to the Center for Disease Control and Prevention, they are also initial symptoms of someone infected with the Ebola virus. We all have viewed and heard of U.S. workers returning home from Western African countries. What a heroic effort. However, some have been quarantined upon their return, be it a directive from the CDC or from state-led efforts. Unfortunately, several have been questioned or even disputed the necessity of the state-led mandatory quarantine by various governors. Because proper quarantine was not administered with the first Ebola patient, outbreaks occurred. I am of the opinion that quarantining is the proper protocol to prevent further outbreaks. Not only does isolation protect the public from the virus, but it protects the patient from public outbreaks. In the case of Thomas Eric Duncan, a Liberian visitor, he exhibited flu-like symptoms upon his first visit to Texas Presbyterian Hospital on September 24, 2014. He was released and returned to the hospital on the 28th, and he tested positive for the Ebola virus on September the 30th. According to the CDC, the incubation period for Ebola is from 2 to 21 days after exposure, after which the first symptoms may occur. The CDC says that if a patient exhibits fever, severe headache, abdominal pain, vomiting, diarrhea, or unexplained bleeding or bruising, and has been to an Ebola-affected country, he should be immediately taken into quarantine. Remorsefully, Duncan came into contact with 12 to 18 people, and they were later quarantined, stated by the Director of Dallas County Health and Human Resources. Hospital officials stated that Duncan did not initially disclose his travel itinerary to the admitting staff. As a result, the hospitals in Virginia, Maryland, and Pennsylvania are updating their entrance questionnaires to include recent travel histories. Nina Farm and Amber Benson, nurses at Texas Health Presbyterian Hospital, contracted the virus after treating Thomas Duncan. During treatment, the nurses were contaminated because of a breach in protocol. The CDC director of Tom Frieden said. They both were moved to 2 of the 5 U.S. hospitals specially trained and equipped to treat patients with Ebola. They are National Institutes of Health in Bethesda, Maryland, and Emory University Hospital in Atlanta, Georgia. Emory University Hospital developed a protocol for donning and doffing personal protective gear. The procedure involves the buddy system, in which one person should watch for any possible errors of dressing. The CDC recommends that patients with known or suspect Ebola viruses should be in a single room with a private bathroom. Each person entering the room should wear gloves, fluid-resistant gowns, eye protection, and a face mask. In the case of large amounts of body fluid, double gloving, disposable shoe covers, and leg coverings are required. Consequently, someone who is not properly trained is at risk for self-contamination. Medical professionals should adhere to protocols set forth by state governments in an effort to protect their public health. However, that was not the case for Casey Hickok, a nurse returning to the U.S. from West Africa, who was registered with a low-grade temperature by a forehead scanner and was quarantined in a New Jersey hospital for 3 days. Governor Chris Christie and New York Governor Andrew Cuomo implemented a 21-day quarantine for people entering the U.S. who were in contact with Ebola patients. Hickox showed one of the first signs of an infected person with an elevated temperature, but she showed no additional symptoms such as muscle aches or headaches. As a result, Hickox left New Jersey and traveled to her home in Maine for a 21-day self-imposed quarantine. According to Tom Friedel, police chief of Fort Kent, Maine, dozens of people called voicing concerns of Hickox's return and presence in Fort Kent. Of all the people, Hickox should understand the procedures set forth by the CDC, since she is an intelligence officer for the CDC. According to the U.S. Constitution, Article 1, a state has the power to impose quarantining inspections of laws to protect public safety. Governors Andrew Cuomo and Chris Christie did just that. They protected the public safety. In addition, governors of Georgia, Connecticut, and Maine followed suit. So make a mental note of the number of people you come into contact with daily, at school, on public transportation, in retail stores. And now imagine if one of those people could possibly have Ebola. Just think of the things that you touch: doorknobs, handles, faucets, a gas pump, just to name a few. Vending machines. It only takes one person with the symptom to start an outbreak. And on the other hand, we could narrow the possibility of exposure to the public by quarantining those who exhibit symptoms. Now the risk for contamination is reduced and the paranoia is kept at bay. It is imperative that we understand and support government guidelines created to keep the American public safe. Acknowledge that a 21-day quarantine can eliminate further outbreaks. Exposed people shouldn't travel by airplane, ships, long-distance bus or train rides, even if they have no signs of the virus. Support tightened restrictions for travel to the U.S. from affected regions, and encourage those who have possibly been exposed to seek medical attention. On a personal note, avoid areas of known outbreaks. Wash your hands frequently. Avoid contact with infected people. And avoid bushmeat, and that is eating and buying wild animals sold in your local markets. So to recap the cases, Thomas Duncan was not diagnosed at the onset of his symptoms, and he exposed at least 18 others to the virus, and he was later succumbed to the disease. He was a risk to the public. And later, Nina Farm and Amber Vincent contracted the virus after exposure and were quarantined to prevent further outbreaks. They were minimal risk to the public. And lastly, Casey Hickox showed initial signs of the virus and was quarantined to later leave the facility against the state's recommendations and return to her home. She was definitely a risk to the public. According to the CDC, quarantines can be applied at the state or national level. Some believe that the governors enacted the mandatory quarantines for personal reasons and political reasons. On the contrary, it was an effort to curtail possible exposure. The governors are just responding to a public health emergency. According to Kimberly Forrest, PhD, the CDC's mission is to promote health and improve quality of life by preventing and controlling disease, injury, and disability. Be safe. Thank you.